Good evening, everyone. Just wait for the go ahead. Before starting the session, good evening, everyone. Myself, Dr. Rijul Agarwal. I'm the Orthodontic faculty at DAMS. So today we are here to discuss the recently conducted NEET MDS exam on the subject recall questions of the subject on orthodontics. Okay. Now there has been some general consensus that the paper has been lengthy. That means that it took time in reading and understanding those questions, and some few of them said that the medical part was difficult. So I haven't gone through those questions personally, but on the group when I was reading, there is a general trend which I saw that on pathology there is a slides on anemia which comes I think every exam. Okay, anatomy image based questions which come every exam. I'm not here to comment on their difficulty level, but when you guys, those who have done the previous year questions, would have seen those trend. I have myself been seeing this for the past now 4 years, apart from the time when I gave the exam. So I think a general trend would have been established that this type of questions can be expected. Rest, I haven't gone through those questions, neither I can comment on their difficulty level. What I can discuss on is on the subject of orthodontics. Orthodontics in this time NEET was clinical based. This is not a trend which NEET follows. It is a trend which is generally followed by INI people. NEET generally have direct questions, but this time they asked you a clinical based question. Nevertheless, there was one or two questions which were a bouncer. Rest all were mostly direct or some clinical based application, not too much difficulty, okay, in understanding those clinical based scenario. And those who one or two questions which are bouncer would have been answered by rule of elimination. I have repeatedly told my student to read the question carefully before setting into a panic mode, okay, because जो bouncer question होते हैं उसका आंसर ना उसी में छुपा होता है options में, and by eliminating those three options you can arrive very well at the correct one. But nevertheless, we are here to discuss, because in a few days time you have your INI May exam, and this time, as I told, it's a very great opportunity since both the exams are occurring at the same time. So the INI result will be declared earlier and the counseling will be done, whereas the NEET result will be declared later and the counseling will go on further. So that confusion that few students post NEET exam leave their seats and go in the INI, and then that confusion occurs, won't happen. So you'll have a clear-cut idea at the time of counseling who all guys are appearing for NEET and who are already done with the INI. Okay, so beginning with the questions, please look at the questions with the intention of not correcting. If I am wrong, if there are option or correction is there, please do write in the comment section. I'll be happy to correct it, because it's a recall based session. I haven't given the exam personally, I have got it from students' memory. Okay, so if there is any correction, I'll be happy to answer or correct that thing right here. If any question you found that the language is entirely different, consider that as a new question, okay, for your discussion, which can come in any future exam for you, or increase your knowledge. Okay, so we are not here to pinpoint or make accurate attempts that this is accurate, that person was not accurate. We are here to discuss and gain knowledge out of it. If there is anything which is not correct, please write in the comment section. I will be happy to correct it right here itself and try to provide you the correct and appropriate answer. Okay, so beginning with the first question, a patient is planned for mandibular widening by distraction osteogenesis. Okay, the surgeon needs help from orthodontist for pre-surgical movement. Fixed orthodontic therapy is planned for divergence of roots of mandibular incisors. This is done with the purpose of. Now, as we all know, the mandible is one continuous bone. So unlike maxilla, we cannot expand the mandible skeletally with the help of any fixed or removable appliances. Like in maxilla, we have Hyrax screws, we have fixed appliance. In mandible, we cannot expand the mandible skeletally. So first question, what is a mandibular expansion appliance? So we have heard about the Schwartz appliance, but it only brings about dental expansion. So for skeletal expansion in mandible, only one thing can be done, that is distraction osteogenesis. तो ये क्वेश्चन हो गया Schwartz appliance, इसकी इमेज देख लेना. Coming back to the question, so for mandible is like this. We need to expand it, so we give osteotomy cut and we place a DO distractor here. So what do we have? We have mandible incisors here. So if we directly place the distractor here, what will happen? It will impinge upon the roots of these incisors. So what we need to do is we need to diverge these roots away like this, so that appropriate space is present for the distractor to be placed and at the same time bring about expansion. So this is what the question is talking about. Okay, now the question is asking what is the purpose. So since I have already explained to you, coming to the options. First option, intrusion of incisors to prevent hindrance in activation of distraction device. It makes no sense. Why need to intrude these incisors inside the bone since the expansion is occurring transversely? This is eliminated. Creating enough bone on both sides of osteotomy for good periodontal health. Now, as I've told you, since the expansion is occurring at this level, we need to provide adequate bone support on the distal aspect, so that when the distraction occurs, what is happening in distraction? We are expanding, so we are creating additional bone at this level. So before we do any osteotomy, good bone support is provided by distal divergence of the root, so that adequate periodontal health of the teeth are also maintained. Okay, just by expanding and not taking care of the dental units or the teeth won't bring about any benefit. So this is the correct answer. For correction of crowning in mandibular arch, doesn't make any sense. For increasing arch length is occurring anteroposteriorly. It's talking about transverse widening. So just by reading the options, even if I don't know about what is DO, what is this question talking about, by eliminating A, C and D, I can easily arrive at the option B. Okay, and that's what we are here to discuss. कभी कभार जब पैनिक क्वेश्चन या मुश्किल क्वेश्चन या इतना आ जाता है कि नहीं समझ में आ रहा, जस्ट ऑप्शंस पढ़ो, क्वेश्चन पढ़ो व्हाट दे आर आस्किंग एंड एलिमिनेट दोज ऑप्शंस and you will be able to arrive at a correct. Option C and D are making no sense. Arch length increase, divergence से how it's possible? अगर प्रोक्लिनेशन भी बोला होता तो भी मैं समझ लेता कि चलो आर्च लेंथ इंक्रीज कुछ हो सकता है लॉजिक. क्वेश्चन में ही देर आस्किंग हम डिस्टलाइज कर रहे हैं, डाइवर्ज कर रहे हैं रूट्स को, आर्च लेंथ इंक्रीज का कोई सेंस नहीं बनता. क्राउडिंग सिम, सी एंड डी तो कोई सेंस ही नहीं है ऑप्शन का. बचते हैं ए और बी. ए इंट्रूजन टू प्रिवेंट हिंड्रेंस इन एक्टिवेशन ऑफ डिस्ट्रैक्शन. अब डिस्ट्रैक्टर डिवाइस लग रहा है यहाँ पर सेंटर में, तो इंट्रूजन से क्या लिंक है उसका? अगर मुझे क्वेश्चन का सर पैर, इवन इफ आई डोंट नो व्हाट्स द क्वेश्चन इज आउट, आई कैन इजीली एलिमिनेट 3 ऑप्शन and arrive at a correct. ओके, सो अगेन आई एम सेइंग प्लीज जब भी ऐसा आए क्वेश्चन, उसको ठंडे दिमाग से पढ़ो एंड आंसर. Okay, so done to increase. Now coming to the question why it's done, it's done to increase interradicular space. Interradicular means increased interroot space. That's what I told you about, so that when it's the distractor occurs, expansion occurs, amount of bone present is more and it can occur. Ensure sufficient bone is present on either side of planned osteotomy. अब एक्सपेंशन हो रहा है, यहाँ पर नए बोन बढ़ रही है, तो रूट्स कहाँ जाएगी 3 डायमेंशनली, वहाँ बोन तो होनी चाहिए ना, इट कैन नॉट गो इनसाइड आउटसाइड द वो. सो डाइवर्जेंस creates bone for planned osteotomy and protect periodontal structure and tooth vitality during and after the procedure. So imagine without diverging you just place the distractor, what will happen? Transverse expansion होगा, roots will come out of the cortex. तो क्या हो जाएगा इससे? Remember washboard effect. Roots cortices से बाहर आ गई बोन के. So एक क्वेश्चन से हमने 3-4 और कॉन्सेप्ट समझ लिए. Next question, this time there went a step ahead from image. Now we have come down to the era of video based question. So it was a simple, in orthodontics it was a simple question that they showed a video of activation of a expansion appliance. Which of these will confirm skeletal movement achieved by it? Okay, so there was a video in which the dentist or orthodontist were turning the screw of the expansion appliance, and the question is asking, so what will be the effect of this expansion appliance, that it will bring out skeletal expansion. So how will you confirm it clinically? So what will be the clinical feature of this activation? Creation of midline diastema, increase overbite, anterior crossbite, distalization of molar, skeletal expansion. Now some students said there was skeletal expansion not present, so I added all 5 options. Okay, so it's a very simple question, creation of midline diastema. Again a question in which if you know that expansion occurs transversely, you can answer it very easily. अब transverse expansion में overbite तो increase होगी नहीं, डिस्टलाइज होगा नहीं मोलर, स्केलेटल एक्सपेंशन तो पूछा ही है, उसका क्लिनिकल इफेक्ट तो ये भी एलिमिनेट हो गया. अगेन एंटीरियर क्रॉसबाइट भी नहीं आएगी, स्केलेटल ट्रांसवर्स पोस्टीरियर एक्सपेंशन हो रहा है. सो अगर आपको नहीं याद व्हाट द क्वेश्चन वाज आस्किंग या you have forgotten what was written in the notes, just by eliminating you would have been able to arrive at the correct answer. And that's what I am here to discuss and tell you about. I'm not here to tell you that correct answer सबको पता है, अब तक इतने लोगों ने डिस्कस करके पता ही था. What I'm here is to guide you and tell you how to arrive, even if you don't know the correct answer, how to arrive at the correct answer. And out of the 15-16 questions which I have for orthodontics, I can say 80 to 90+ % questions I can arrive by just by eliminating, if I have a cool mind and I read the questions silently with that mind. Okay, so that's this question. Coming to the notes which was written, that it's the most noticeable feature during RME is appearance of midline diastema. The amount of incisor separation is roughly the amount, half the amount of jack screw separation. Okay, so अगर 1 mm स्क्रू खुला है, इनका सेपरेशन हुआ है, तो 1/2 mm midline diastema approximately appear होता है. Okay, and it closes automatically in 3 to 5 months with the help of transeptal fibers. Okay, so these are the few other facts present in your notes, lectures. Just a quick recap of those points. Okay, तो इसमें क्या याद रखना है? क्विक रिकैप, पिच ऑफ द स्क्रू, RME appliances की images देख लेना. I'm telling you this with the aim of your next NEET exam. Okay, और हाँ, retention कितने दिन का होता है? So post expansion you need to leave the screw for 6 months for the bone to form. Okay, तो screw as it is cemented रहता है, expansion की turn करना बंद कर देते हैं, and that's it. Okay, again a very easy question, which appraisal is used to overcome the limitation. So it was a direct, so this time paper या तो question है कि आपको दिमाग लगा के eliminate करना है, या it's a direct question. So again it's a direct question, nothing to explain. Which, so this type of question you cannot arrive by rule of elimination. If you know, you know. If you don't know, you just have to move it. So used to overcome the limitation of, so it's the A and B angle. Okay, so antero-posterior skeletal dysplasia indicators, इसमें क्या क्या आते हैं? क्विक रिकैप: फिक्स अप्रेसल, बीटा एंगल, वीएन एंगल, ओके, ए एन बी एंगल तो आता ही है, विच यू हैव स्टडीड। स्टीनर्स में है विट्स अप्रेजल, किसने दिया था? यूनिवर्सिटी ऑफ विट्स वाटरलैंड, जेकबसन, अलेक्जेंडर जेकबसन ने दिया था। दीज आर ऑल योर प्रीवियस क्वेश्चंस, सो दिस वाज अ डायरेक्ट रिपीटेड क्वेश्चन, नथिंग मच टू एक्सप्लेन। एस एन ए एस एन बी एंगल किसने दिया था? रीडर ने दिया था। एफ एम ए क्या है? फ्रैंकफर्ट मैंडिबल प्लेन एंगल। सो yes, option answer D is correct, but I am here to discuss right now. मुझे correct answer, sorry, I'm not being rude here, I'm okay. If you find any answer which is your answer is different and you have a different logic from my reasoning, please do write in the comment section. I'll try to incorporate or explain it to you, okay, what I have studied, what I have in mind. Okay, next question: a patient presents with class 3 malocclusion due to maxillary deficiency. Okay, very direct question. Orthodontist planned a face mask. Okay, and noticed clockwise rotation of maxilla and frontal lengthening of lower face. What should be done to prevent this? Okay, so maxilla पीछे है, मैंडिबल आगे है, इसको आगे पुल करना है। तो जब आगे पुल किया यूजिंग फेस मास्क, व्हाट हैपेंड? दिस रोटेटेड डाउनवर्ड. Why? Because of the downward rotation of maxilla. Okay, so what should be done to prevent this? Reduce force to 800 gram. Okay, only night time wear. Okay, direct forces horizontally towards the occlusal plane. Place elastics on inferior surface of maxillary splint. So there is a maxillary splint which is present attached to the RME screw using hook. Okay, सो व्हाट विल, अगर हम इन्फीरियर सर्विस पे लगा के करेंगे तो और ऐसे फोर्सेस होगी, ये और इसको कर देगा. नाइट टाइम वेयर और रिड्यूसिंग फोर्स लेवल won't bring about any change. Why? Okay, already it is written that it's not because of force level or increase. Night time wear, you know, orthopedic appliances का force level और duration it's fixed to bring about orthopedic changes. If you reduce this force level or reduce the duration, orthopedic effect won't be there. So A और B eliminated. बचता क्या है? डायरेक्ट फोर्सेस हॉरिजॉन्टली टुवर्ड्स. सो व्हाट्स हैपनिंग? सो व्हाट्स हैपनिंग? सो दिस इज द फोर्स लेवल. अगर फोर्स लेवल डाउन है इस स्क्रू से, व्हाट विल हैपन? मैक्सिला ऐसे रोटेट हो जाएगा. सो व्हाट वी शुड डू? वी शुड डायरेक्ट द फोर्सेस हॉरिजॉन्टली so as to avoid. So this again a snapshot from the notes that in patients with a vertical growth pattern, elastics are placed generally parallel to the occlusal plane. So this is determined pre-treatment only. Okay, so pre-treatment only we determine the force level and the force direction. Okay, again a very direct image based question. Identify the appliance given below. So it was, I don't know whether the image was this provided or not. I just picked it up from my notes. The image was of twin block, everyone told me, so I picked up that image only. So you know the images of bionator, activator, Frankel. Last year NEET में I think you got 2025 में you got bionator image. Frankel तो बहुत बार आ चुका है, you know. Activator आज तक नहीं पूछा है हमने image में अब तक, recent time में. Previously they might have asked and now they have asked twin block. So I think next time they can go for fixed functional image. So fixed functional, just remember there are 3 types: hybrid, rigid and flexible. Identify करने के तरीके, just remember them. Image एक बार go through कर लेना before exam, next exam. If you remember then well good. If you don't, post my this lecture. Those who have joined live can go through them. Those who listened to it on a recorded version can go through it for a quick recap. Identify the appliance. Now some said this image came, some said this, so I put up both the image. So the first image is of a W arch. This is of quad helix. Again a direct image based question. Higher X or TPA की image you know. TPA is transpalatal arch, higher X is higher X expansion screw. So if first image came, then it's W arch. So I ended that debate. Some said this comes, some said this. So I provided both the images here. Okay, so both are used for slow expansion. Both are slow expansion devices, slow maxillary expansion devices. Okay, how to activate parts of quad helix, how to activate, किस आर्म को खोलेंगे, क्या एक्टिवेशन होगा, किस हेलिक्स को ओपन करेंगे, क्या चेंज आएंगे, गो थ्रू इट, क्विक रिकैप. Next question. Which of the following part of the appliance needs fixing repeatedly as they get loose because of repeated insertion and removal? So what I got feedback got from the student was that this was the options were images, 4 images were provided, okay, of various parts of the AIIMS class. So these are the various parts of the AIIMS class. So instead of image I just wrote down the points. So what are the 4 parts? First is the arrowhead. This is the arrowhead which go into mesial and distal undercut. This is the bridge. Crossover wire goes over the tooth surface and retentive tag goes inside the acrylic. So what happens due to repeated insertion removal? Which parts needs frequent adjustment? So which parts needs to be activated frequently so that the appliance stays rigid? So first of all, what is a AIIMS class? AIIMS class is a passive component of the appliance, not a active component. What are active components? Those who exert active forces like the labial bow and all that. Okay, coming to the passive components, what happens due to repeated insertion removal? They get fatigued or loose, so they needs to be adjusted. A bridge hai center part, obviously baat hai, you cannot adjust it. Retentive tag goes inside the acrylic, you cannot touch it, okay, using pliers. So what remains is arrowhead and crossover wire. Crossover wire goes over this, so you cannot bend it, okay, because it's passing through the mesial and distal contact points of the molars, if it's given on the molar or premolar, whatever tooth it's given. What remains are the arrowhead which goes inside the mesial and distal undercut. And because of this repeated fatigue of these arrowheads, okay, so that's why this delta class came up, which was developed by William Clark. So what used to happen, this repeated fatigue and failure of these arrowheads, and twin block, as we know, is worn. What is the time period schedule of a twin block? It's generally worn for a year or so. So we cannot afford to refabricate the appliance repeatedly. A holly plate can be refabricated easily, but a twin block cannot be refabricated because of the failure of this class, AIIMS class. So that's why this delta class came into being. Okay, so it's less adjustment and less subject to breakage. So the correct answer here is arrowhead. Moving on further ahead, अगर ये arrowhead को कैसे adjust करोगे? So we need to have a 139 bird beak plier. OPD में तो हाँ हम universal plier में से ही सब कर लेते थे, but right now we are here a theoretical paper, so you need to remember that 139 bird beak plier is used to adjust these arrowheads. Okay, additional information. Identify the type of face mask. Again a direct question, image based question. Delayer petted reverse pull headgear chin cup appliance. Reverse pull headgear is another name for face mask in general. They are asking about the specific name of the person who gave this kind of face mask. It was Delayer face mask. So petted has a single rod, Delayer has 2 rods. Petted has a single rod which comes through the nose. Delayer has 2 rods which are not in front of them. Both act similarly. It's just based on the type operator which one they want to use. There is no other difference between the two of them. Apart from that, Delayer has 2 rods, Pettit has a single rod which comes from center. Okay, others or people have also given, that is Iris and Nakamura appliance. Okay, just remember their name, no need for any image for them. Next question, identify the right marked area. Very easy question. Cephalometrics, identify the cephalometric landmark. So it is a sella turcica. Optic canal, carotid canal, sphenoid sinus, or whatever options were there. Okay, we know the correct answer is sella turcica, which was asked. Okay, so this is orbital, this is PTM point. Okay, this is gonion, basium. Okay, so just go through those anatomical landmarks. अगर किसी को याद नहीं है, unilateral, bilateral landmarks, derived landmarks, just go through them. Quick revision. Next question. Again a question on face mask. So this time we had a lot many questions on face mask and expansion, class 3 expansion. Okay, a boy presented with mid-face hypoplasia and intrusion with breathing difficulty and maxillary posterior crossbite, not corrected with timely adenotonsillectomy. Okay, patient has normal BMI and normal mandibular position. Which of the following is suggested for its management? अब किस ऑर्डर में क्वेश्चन आया था, पिछला पहले आया था, ये बाद में, या ये पहले बाद में, doesn't matter. Okay, the question came as a new question and a very direct and easy question. मिड फेस हाइपोप्लेजिया दे दिया उन्होंने, मैंडिबुलर नॉर्मल दे दिया, डायरेक्ट आप पहुंच गए फेस मास्क देना ही है. सेकेंड उन्हें दे दिया मैक्सिलरी पोस्टीरियर क्रॉसबाइट है, तो हमें RME अप्लायंस भी लगाना है. कमिंग टू द ऑप्शंस, ट्रांसवर्स एक्सपेंशन ऑफ मैक्सिला, येस बट नॉट कंप्लीट. वेट लॉस फॉर ओपनिंग ऑफ pharyngeal airway, patient has a normal BMI, gets eliminated. A also gets eliminated. Mandible advancement for correction of OSA, it says the mandible is normal in position, that's eliminated. That leaves us with last option, expansion with face mask. That's the correct answer. So a very easy and direct question. I don't know about other subjects, but till now in ortho I haven't found a question which was a very bouncer question. Okay, or a question which was saying that मतलब उन्होंने क्या ही पूछ लिया, which you haven't studied or which you haven't seen. Okay, correct me if I am wrong, anyone. I'll take back my words, I have no issues. Again, so Hickam was the first to use face mask, most effective if given in young growing children. McNamara and Rudon advocated the use of RME with face mask. And indications, class 3 skeletal malocclusion, also known as reverse full headgear, works best in young growing children around 8 years of age. Next question. Tooth movement was reduced. Upon evaluation, the force came out to be excessive. What is the reason? So this question is from Biology of Tooth Movement. Okay. Now it's written that the force was excessive, because of which tooth movement was reduced. Coming to the option, bone deposition on opposite side. Now this is the tooth. Supposedly it's moving in this side. Okay. Because of excess force, the tooth movement slowed down. Bone deposition on opposite side, मतलब on the side opposite to the side of movement of the tooth. So यहाँ deposition हो गई, so that is normal, it should happen. Remove it. Increased osteoclastic activity, that's very good. If osteoclastic activity बढ़ रही है तो means bones resorption बढ़ रहा है. Again eliminated. Cementum resorption only. Option B, hyalinization of PDL, and D, cementum resorption only. Okay, now excessive force leading to cementum resorption. What is cementum? Cementum is like enamel of root, so it is a covering present on the dentine. So cementum resorption, because of excessive force, it really occurs. Okay, excessive force will cause increased bone resorption. Okay, and If that force is still high, then it can lead to cementum resorption. But here they are asking that why was the reason for reduced tooth movement. So yes, the correct answer is hyalinization of teeth. So what is hyalinization? So it occurs due to undermining or rearward resorption. So remember from biology of tooth movement, there was two concepts: frontal resorption and undermining or rearward resorption. Okay, so because what is hyalinized tissue? Hyalinized tissue you don't have to confuse with the hyaline connective tissue from your pathology and histology. Okay, it appears hyalinized or avascular because there is absence of any cells. What happens due to excessive force? The tooth touches the bone here, so there is absence of any cell here. Okay, so for tooth movement to occur, if you remember, there should be osteoclastic and osteoblastic activity. Osteoclasts are also cell, osteoblasts are also cell. So अगर यहाँ bone resorption ही नहीं होगी, means cell ही नहीं आ पा रहे, so movement अपने आप slow down हो जाएगी. Simple. Okay, so again a very basic direct question, nothing much to explain in this. Next question: the tooth which was moving steadily earlier suddenly started tipping. What could be the reason behind it? Now there was a tooth जो steadily move करता, like means that it was moving bodily. Now instead of bodily movement, what happened? It started tipping. What could be the reason behind it? Coming to the option: center of resistance shifted to coronal side, center of resistance shifted to the apical side, there was no change in center of resistance, and change in force magnitude or change in force direction. Okay, so basically ऑप्शन देख के पता चल रहा है कि ये लोग सेंटर ऑफ रेजिस्टेंस के बारे में कुछ पूछना चाह रहे हैं कि टिपिंग में कहाँ रहता है, बॉडीली मूवमेंट में कहाँ रहता है. तो ऑप्शन सी तो एलिमिनेट हो गया. ए, बी और डी, चेंज इन फोर्स मैग्नीट्यूड और चेंज इन फोर्स डायरेक्शन. ना क्वेश्चन में तो कुछ ऐसा बोला नहीं है कि फोर्स का वैल्यू चेंज किया है या डायरेक्शन चेंज किया, नथिंग एल्स. सो ऑप्शन डी भी एलिमिनेट हो गया. सो व्हाट रिमेन्स इज ऑप्शन ए, बी, वो भी दोनों सिमिलर लग रहे हैं, तो माइट पॉसिबल कि उधर हो सकता है. नाउ ईदर द सेंटर रेजिस्टेंस हैव शिफ्टेड कोरोनली मींस टुवर्ड्स द क्राउन साइड, और ईदर इट हैज शिफ्टेड टुवर्ड्स द एपिकल साइड. प्लीज इग्नोर किस तरह से हुआ, किस वजह से हुआ, इसके बारे में कुछ नहीं पूछ रहा. दे हैव जस्ट आस्क्ड यू कि सेंटर ऑफ रेजिस्टेंस कहाँ हो. सो सिंपल लैंग्वेज में दे आर आस्किंग कि टिपिंग के टाइम या अनकंट्रोल या कंट्रोल टिपिंग के टाइम सेंटर ऑफ रेजिस्टेंस कहाँ होता है. तो it is apical to the center of resistance from body. Simple. So bodily movement में यहाँ होता है center of resistance shift apically or tipping as compared to bodily. Clear? नेक्स्ट क्वेश्चन. ये क्वेश्चन तो आई थिंक आई हैव डिस्कस्ड, highlighted in my revision session in my class, and each and every time which malocclusion the following will turn into. So students said that there was a picture of flush terminal. Whether it was mentioned in the question or not, I don't know. Some said it was mentioned, some said it was not mentioned. So there was an image of flush terminal and it was asked which kind of malocclusion it will turn into. So I have discussed repeatedly in my revision session, in my class. Initially erupt into can get converted into, due to late Mandel shift can get converted into class. Initially erupt into end-on. End-on का तो option नहीं था, या था तो भी they are asked which following it will turn into. So Baum's classification is valid for primary, second molars, that is the E's. So they are initially into flush terminal plane. They will initially erupt into end-to-end. The 6, that is the permanent first molar, will erupt into end-on molar relation and later on get converted into class 1 molar relation due to late mandibular. Again a very easy and direct question. this question थोड़ा सा tricky था. We'll try to answer it based on our understanding. It was a biomechanics का question था जिसमें उन्होंने appliance design technically आपसे पूछ लिया. Mandibular second molar is drifting measly due to premature loss of mandibular first molar. Possible. What should be done to upright the tooth with minimal intrusive effect? ये 6 missing है, ये 7 है, 5, 4. So as we all know, if there is space loss, the 7 and it's fully erupted, it will close that space by mesial drifting. अब वो mesial drifting does not mean that it will occur bodily. वो mesial tipping start हो जाती है. Very common scenario you all know as a BDS graduate. और similarly ऊपर का भी tooth होगा 6, तो it will start to get extruded. Okay, but we are not here to worry about that. We are here to worry what to do with the 7s now. So what should be done to upright that 7 with minimal intrusive effect? So we need to just upright that tooth so that 6 की space regain हो सके and we are able to plan, implant, prosthesis, whatever. Okay, full fixed appliance with continuous arch wire leveling with open coil spring. Okay, so what we can do is we can place a continuous arch wire and place a open coil spring. What will do? Open coil spring यहाँ open होगा, it will exert force on this teeth और उससे वो 7 upright हो जाएगा. But at the same time, it will exert force on the teeth on the premolars as well. So what will happen? Premolar भी mesial tip करेंगे, ये distal tip करेगा correction के लिए, premolar will start to tip mesially. और premolar क्या आगे क्या canine, incisors and all that. तो क्या होगा? They will also start to get procline. चलो हमने proclination prevent कर ली by some other means. But the question says with minimal intrusive effect. So what will happen? जब ये open coil spring लगेगा तो what will happen? This molar will start to upright and at the same time it will start to intrude as well. Okay, so somewhat can be considered. Okay, if you don't know, मतलब इतना उस time पे नहीं सोचा. But let's go to the other option as well. Option C. I'll come back to option B. Option C says heavy continuous force with rectangular SS wire. Okay, so if ऑलरेडी टिप्ड है, हम रेक्टेंगुलर एसएस वायर प्लेस कर दे एक स्ट्रेट, व्हाट विल हैपन? हाँ, ये अपराइट होगा, डेफिनेटली होगा. एक स्ट्रेट एसएस वायर डाल दो टेढ़े दांत पे, वो अपने आप पर विल यू बी एबल टू एंड व्हाट डज बायोलॉजी ऑफ टूथ मूवमेंट सेज? यू कैन नॉट एक्सप्रेस और पुट हैवी फोर्सेस. व्हाट विल डू? रूट रिजॉर्प्शन, मोबिलिटी ऑफ द टीथ और स्टॉपेज ऑफ. ऑप्शन सी गेट्स एलिमिनेटेड. Adjacent first molar and spontaneous uprighting means अगर इसके पीछे थर्ड मोलर है उसको भी एक्सट्रैक्ट कर दो एंड स्पॉन्टेनियस अपराइटिंग. ओके, कैन बी कंसिडर्ड. ओके, बट देयर इज हियर इट्स आस्किंग what should be done, what kind of appliance should be done. I don't know whether this option D was there or it was some part of some other more statement. D is somewhat kind of a wave kind of an option. Okay, because what happens when 7 gets mesial tip, अगर 8 उसके present है वो भी mesial tip होगा, so you need to extract it so that 7 gets upright. Understandable. And there was one option with elastics. If you can elaborate where and what was the option, I'll be happy to add that option as well. That's why I put up a question mark here. Coming to option B, uprighting spring using segmental or sectional arch wire. So in our classes and revision session as well, we have discussed there are two kinds of mechanics for space closure: sliding mechanics and segmental mechanics. So what is sliding mechanics or continuous mechanics? Option A is example of that. That there is a continuous one arch wire from left to right connecting all the teeth. Okay, and you use coil springs and all that for space. And for segmental mechanics, you divide the teeth into segments, and these are the loops which are used. We have discussed the images, but we are here to discuss this question. So what are these loops? These loops we have discussed that. I will erase this. These loops have inherent bends being placed in them so as to avoid. Now, what we do is we divide the arch into segments. We don't place a continuous arch wire. Okay, so we connected the 3, the 4 and 5. We can involve other teeth as well. It depends upon the type of biomechanics, type of force level we require. Okay, so we connected them with a single rectangular or heavy arch wire, and there is no single arch wire extending to the second molar. So using a uprighting loop, we place it and connect it. Remember, like a cantilever spring or for uprighting. Okay, just a minute. Just a minute. So it has a 1 point contact. Remember, determinate and indeterminate, one couple and two couple system. So what will happen? One couple force system, if you remember, determinate force, 1 point force. So when it's placed, it will exert a uprighting force, and at the same time it will have minimal intrusive effect. Why? Because the amount of activation which is done is determined. You don't bend it. The initial design is like this. You forcefully with a plier and place it here. फिर थोड़ा सा uprighting होगा, you feel again activate it, again bend it, place it, so that slowly the second molar gets uprighted. And once it's uprighted, whereas in continuous arch mechanics, once you place the coil spring, it will continue to act जितना आपने उसमें compression दिया है. Okay, that's why it is said that segmental arch mechanics have a fail safe mechanics. जितना आप उसको activate करोगे उतना ही वो act करेगा. Whereas continuous, these coil springs don't have a fail safe mechanics, because वो नाइटाई की inherent tendency है उतनी देर तक act करता ही रहेगा. So supposedly a patient misses the appointment, doesn't report, या आपने नहीं देखा, वो पूरा कर चुका होगा तब तक जितनी उसमें inherent elasticity या present हो. Okay, hence option B is the correct one. Here I can say you need to apply थोड़ा सा दिमाग and your concepts for you to answer, but nevertheless not a question जो मतलब bouncer या you haven't done discuss in the class. Next question, again a little tricky question I can say. What is the correlation between periodontal treatment and orthodontic extrusion when the tooth is fractured from below the gingival margin? Okay, so there is a tooth, यहाँ gingival है. Okay, there is a fracture below the gingival margin. ये part उड़ गया. Okay, so common. Now what generally it's planned is that we need to अब यहाँ crown level तो बचा नहीं, so how will you place a crown or something post and core, anything you need to be planned. So you need to orthodontically extrude this teeth so that some amount of margin is available for the prosthodontist to rehabilitate this crown. Okay, for restorative purpose. Okay, so it's a very common thing, procedure which is done. Sometimes we need to intrude, like in the previous scenario as I've told you that empty space में 6 अगर extrude हो जाता है, then we have to intrude it so that a crown can be placed. Somewhere similar kind of scenario here. The teeth has fractured below the gingival margin. RCT is being done. I need to extrude it out, bring it out so that a prosthetic rehab can be done. Okay, so how much amount of, first of all, extrusion is done? So it depends upon 2 or 3 factors. First, the biological width, the crown margin, and the sum of these 2 factors. So basically you can say 2 factors mostly. So what about the crown? So 1 mm crown margin is required. So for the adequate, or you can say a retentive good functional crown to be placed, and biological width, approximately 2 mm of biological width is required for extrusion. So the distance the tooth should be extruded is depends upon the location of the defect, that is the fracture line, root perforation or resorption site. Space to place the margin. So technically 1 mm is needed based, it's not something which is determined. Clinical scenario can vary depending upon the situation of the case. Theoretically says that 1 mm of margin is needed, and biological width for gingival attachment, so about 2 mm is needed. So 3 mm extrusion is done in ideal cases. If the fracture is 5 mm or more below, so technically approximately 5 mm extrusion should be done so as to determine an adequate crown placement. So what is said that 1:1 crown to root ratio is the most favorable prognosis in treatment. That is, अगर 10 mm का crown है तो which हम place कर रहे हैं तो approximately 10 mm का root should be there. That is the height of the crown. हम एक level तक ही we can extrude it. ऐसा नहीं है we give a bulky 12 mm hypothetical and the root is 8 or 7 mm. That tooth won't survive. So the ratio of the crown height and the root should be same. That much amount of extrusion can be done so that the ratio is maintained. And next comes these factors. Okay, so if the fracture, I've just put up example, if the fracture is a height of the alveolar crest, that should be extruded about 3 mm, 2 plus 1. If it's 5 mm is, if it's 2 mm below the crest, that is, अगर ये fracture यहाँ से 2 mm और नीचे है, then 5 mm extrusion is needed, 3 mm for this factors and 2 mm for extrusion. But in the end, this ratio should be maintained. And if the ratio is not there, then you need to splint it with adjacent teeth for its maintenance. For the tooth to get survive, then the crown needs to be splinted with the adjacent tooth. That is either a bridge to be planned for that tooth, or you can in the end need to extract and go for a implant based restoration. So a good question, theoretical question you can say. So second question which you can say, thoda sa bounce hai. Next question, what is the limitation of clear aligners as compared to conventional orthodontic treatment? Again, I discussed this in my revision session as well. Okay, class as well. Last time I also had a lot many questions on aligners as well. So जनरल परसेप्शन और जनरल थिंकिंग इज दैट व्हाट इज अलाइनर. अलाइनर क्या होता है? एक प्लास्टिक ट्रे होती है जो दांत को चारों ओर से, दिस इज द टूथ, ये अलाइनर ट्रे है जो उस पर ढक ले. तो अगर एक प्लास्टिक टूथ को चारों ओर से ढक लेगा तो व्हाट डज इट डू? इट ऑफकोर्स इट वर्क्स ऑन पुश, इट पुशेस द टीथ. whereas what does a fixed appliance of braces do? braces यहाँ एक ब्रैकेट बकल सर्फेस पे लग जाता है, उस पे वायर होती है. what does it do? it pulls the teeth, pull it. तो अगर ब्रेसेस का जनरली टेंडेंसी पुलिंग का है, खींचने का है, तो what it will be easily able to do? it will be able to do extrusion easily. अगर हमें इंट्रूजन करना है तो हमें अपना दिमाग एंड ऑल दैट नीड्स टू बी डन. आई एम नॉट सेइंग नॉट पॉसिबल, इट विल बी डिफिकल्ट. वेयर एज इन अलाइनर्स जो एक प्लास्टिक ट्रे पूरे ढक लिया है, पुश कर रहा है टीथ को. पुश कैसे कर रहा है? आप दांत बंद करो, ट्रे टचेस द टीथ, पुशेस इट, सो इट विल बी एबल टू डू इंट्रूजन. पुश कर रहा है, डिस्टलाइज द टीथ, whereas it will be able to do mesilize the teeth. Okay, coming to the options, limitation or you can say difficulty, intrusion is very easy. Okay, mild crowding to mild midline diastema closure, easy with linus. Single tooth extrusion, very difficult. Possible but difficult. So option A, that is the limitation. So less predictable or difficult, severe rotation greater than 20 degree, extrusion with no retraction, mesial movement of posterior teeth, space closure with mesial movement of posterior teeth, that is a minimum anchorage case, very difficult with the liners. Braces very easy. Short clinical crown like the situation which we discussed earlier, we need to extrude their teeth, very difficult, partially erupted teeth, or a less mature teenagers, that is mostly compliance based. Last point, less predictable. So understood. So these were the questions which came in your exam. So out of the 16 questions which I had, I think 2 questions were a little difficult in the subject of orthodontics, which if you knew the concept you would have been able to answer. If you didn't, then it would have been difficult, and I think you would have left that question. These were the 2 questions related to the periodontal treatment and extrusion and uprighting spin. Rest or were, someone said moderate difficulty in clear aligner was asked, but the option same. You can tell me Saloni June 12-10, moderate difficulty, but the options same or different, you can tell. If the options were same and the question was on moderate difficulty, then also the answer will remain single tooth extrusion only with aligners, because extrusion is a difficult thing for aligners, and the reason I've just explained to you. If anyone can highlight the options or if there is any confusion. If the question was on moderate difficulty and the options were same, the answer remains the same, that is single tooth extrusion. It is a difficult, you can say moderate, high. Now the liners have different attachments and all that. I'm not going to go into that at this level, but it's a difficult process. Rotation more than 20 degree, extrusion, it's difficult with liners. We need to take help of auxiliaries for that. I'm not going to confuse you with that. Just remember this table for least predictable movements or difficult movements, and likewise easy movements and all we have discussed. You can go through the revision session available on the app. Okay, and there I've made a table for everything. Okay, any other question? So this was my opinion when I went through these 16 questions, that 2 were a little difficult questions, rest all were very direct and basic. Kuch bouncer tha, you would have able to arrive by simple elimination. Okay, rest all subjects I cannot speak about, but orthodontics was like that. I expect now that you have started put the preparing for your next INI exam. Okay, कैसा गया, क्यों गया, उसने ये किया, forget about it, just go ahead, get back now. Okay, एक दिन का break Saturday का Sunday was more than enough. Okay, now you have to get back, and the only way to keep this like the way I arrived by eliminating the option is give as many tests as possible. जब दिमाग को वो आदत बन जाएगी कि वो देखना है, और उस टेस्ट जितने आप फुल कोर्स के, नॉट सिंगल सब्जेक्ट टेस्ट, और वो फुल कोर्स ऑल 19 सब्जेक्ट टेस्ट जितने आप दोगे उतना ही आप इजीली यू विल बी, योर माइंड विल गेट इनटू द हैबिट. You get stuck in that question, calm yourself down and arrive at the option. Same option, sir, then the answer remains the same. Okay, उस टेस्ट में भी जितना आप स्टक करोगे जिन क्वेश्चंस पे, keep yourself a cool mind and arrive by elimination. और जितना आप उसको आदत पड़ेगी, same thing will be able to replicate in the examination hall as well. So I wish you all the very best. Any difficulty, any doubts, please, you can very well message me. Okay, I will be happy to help. Post it on the group, post it on Facebook group, WhatsApp group, anywhere. I'll be happy to help. So all the best for your next exam. Okay, so I'll close the session. Thank you for joining. Good evening, everyone.